Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Erin Karn Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along. This is Dr. Samreen Vora, and on today's episode, we have Dr. Penny Watts and Dr. Carmen Turkelson. Dr. Penny Watts is a professor and associate dean for the Office of Technology and Innovation at the University of Alabama at Birmingham, UAB School of Nursing, and serves as assistant director for the UAB Office of Interprofessional Curriculum. A seasoned critical care and emergency nurse, Dr. Watts has been an educator since 2000 and received formal simulation training from the Center for Medical Simulation. Her scholarly work centers on interprofessional education with a focus on faculty development and interprofessional initiatives and best practices in simulation education. Dr. Watts currently serves as president of the International Nursing Association for Clinical Simulation and Learning, INACSL, and is an associate editor for Clinical Simulation in Nursing. Dr. Carmen Turkelson is a professor of nursing and the director of the Center for Simulation and Clinical Innovation in the School of Nursing at the University of Michigan, Flint. Dr. Turkelson earned her doctorate of nursing practice with a focus on interprofessional education using simulation from the University of Michigan in 2013. She received her Master of Science in Nursing Education from Michigan State University in 2008 and her Bachelor of Science in Nursing from MSU in 1993. Dr. Turkelson has been a nurse for over 30 years and has extensive experience in critical care, management, education, and simulation. Dr. Turkelson's research explores the use of simulation, aspects of learning, interprofessional teamwork and communication, and patient safety in both acute care and academic settings. Dr. Turkelson is currently the president-elect for INACSL. Welcome to both of you to our podcast today. And I know we just heard your bios, but I'd love to give you a chance to say hello to our audience and share anything else that maybe isn't part of that more formal bio. Do you want to go first, Penny?
Sure. Thank you. I'm so excited to be here. I've been looking forward to spending some time with you today. So I am Penny Watts, and I'm the current president of INACSL. I've been involved in that organization, 15 years or so, and just love simulation. And I think when I was in nursing school and graduated 2 years later, I went back to work in the lab. So I think my career's come full circle. So anyway, glad to be here.
I love that. I'm excited to hear more about this full circle path you took. Carmen?
Hi, I'm Carmen Turkelson, and I'm the president-elect for INACSL, and I'm following in big footsteps behind Penny in June this year. I am also super excited to be here with everyone to kind of share my journey in simulation and some of the opportunities that our organization offers.
I love it. We have the two rock stars here. I've heard, we've had a chance to chat offline a little bit, and just hearing the two of you work together has been really great to see that level of partnership at such a high level. So president and president-elect of INACSL. I'd love to start by hearing, we'll come back to this INACSL piece because there might be folks in our audience that aren't as familiar with INACSL, and I know we're going to go kind of a little bit more in depth in that. But I want to back up and just ask you both a little bit about your journeys. You both sound very passionate about simulation, and I love that. That will really resonate. Our audience of pediatric simulationists from across the world are often very, very passionate and all take very different paths to get to where they are in either IPSS or just in their own institutions, and collaborations across institutions doing simulations. And so I'd love to hear, and I think they'd like to hear, how did both of you get to where you're at, where you are the president of the society that's really setting standards across the world in simulation? Where did you start and how'd you get here?
Well, I guess I'll start. I said my journey started after I graduated nursing school. And in nursing school, and I was graduating, I was a really good book student. I passed the test. I did great. I was okay in clinical. I'm a very hands-on person. And the day I graduated, I said, I'm going to go back and get my PhD, and I want to change nursing education. And I didn't realize all of this. It took me a while to get to say, oh, I know where that started from. But 2 years after I graduated, I came back to my town where I graduated from and actually worked it wasn't a simulation lab at the time, it was a lab. And I helped with skills checkoffs and teaching students basic skills on the task trainers that we all have, and finished up my master's. And then eventually, after some work in clinical and so forth, worked into academia into 2006. And at that time, I loved the lab. And about a year into my starting at the nursing school, I kind of dabbled into sim a little bit, but met someone who was my mentor for almost 10 years here, Chad Epps, which so many people know. And I would say he drug me along everywhere he went to learn different things and taught me. And it was that mentorship that I've tried to instill in others. So I think that's sort of where I started and didn't realize it, that I have come kind of full circle in helping others learn by doing, because I think applying it is so hard and I have to do it 1,000 times. I'm not one to go, one time and you're done. So that's a little snippet to kind of where I am today. And through the INACSL journey, I was given many opportunities and volunteered. And so now I consider what Carmen and I are doing are giving back to the members and helping those that are just starting or are even experts in sim. So I feel like I'm giving back quite a bit.
That is awesome to just hear on your educational journey and then how that led to simulation and also mentorship from Chad Epps. I imagine a lot of folks knew him and he was really
Yeah.
a mover, shaker, just a doer that a lot of folks
Mhm.
had very good
Mhm.
relationship with. So that's really cool that you had that opportunity
I
to
was
be mentored.
very
And
lucky for almost
yeah,
10 years, and the opportunities that came from that, I think really has propelled where I am today and giving back to the sim community that gave so much into me and my work and the mentors I've had over the years. So it's been great.
always full circle. Carmen?
Well, my journey, it's a little bit different. And I mean, mine actually started with a scenario that almost ended my nursing career. So, right out of graduating from my bachelor's program at Michigan State University, I went into an ICU. And not to make myself sound super old, but back then, graduates didn't go into the ICU. And so I felt really proud that I got this job in an ICU. And to keep the story short and simple, it did not go well. I had a preceptor that was very determined that new grads shouldn't be there. And I was
Yikes.
miserable and actually, questioned whether I wanted to be a nurse. And I could share the things that were done to me, but I won't share them because they're that
Mm,
horrific. And at the time, I hadn't sat for my boards and I just really, would go home crying every night. It was a really, really difficult time for me. And I'm glad that I stuck to my goal and dreams of always, wanting to be a nurse from a very young age. But I wouldn't have known until now, or even, a few years later, that that's what's really driven me into an education role, is that I never wanted somebody else to feel like that, to feel like they can't ask a question, to feel like they could ask for help, especially around patient care and patient safety. And so that's really driven my passion for education. Eventually, I went to another job for like 9 months and then got progressive care. And I've spent more than 30 years in the critical care environment and went back and got my master's degree focused on nursing education. And I had, like Penny said, dabbled a little bit in the sim lab during that experience. And I got hired as the educator for critical care in the hospital where I was working. And my boss sent myself and a colleague, she said, we're going to send you to a conference. And she never did anything like that. So Mary and I were like, yes. She sent us to see Pam Jeffries, Dr. Pam Jeffries. And I think she was at Indiana University at that time. And we were just, wow, blown away at what we could do in the hospital side with simulation. And when we got back, my director said, well, guess what? You're implementing simulation into the critical care education program. And Mary was over med-surg, and that's how I got started. So probably not unlike many other people being sort of thrown into it with no real training or experience other than hearing one of the most inspirational people that you could at the time. So I really tried to find people that could help me advance my knowledge. And I sort of call myself a fellowship junkie. I did the NLN National Sim Leader Fellowship. I joined INACSL and did the INACSL CAE Fellowship and then the INACSL Research Fellowship. And by doing these things and participating in INACSL, the National League for Nursing, the League for Simulation and Healthcare, I had opportunities, like Penny said, to be amongst the sim leaders and have mentoring and encouragement from those individuals that really helped me advance my knowledge and my career. To be quite honest, I'm here today because of all of those individuals. I'm not here on my own accord. Nothing happens by accident. And there were people along the way that saw things in me that I didn't see in myself and gave me opportunities to get more involved in INACSL. And I'm deeply appreciative of that. And like Penny said, I feel now it's where we're at. It's our opportunity to do, to turn around and help those future leaders and nurses and simulationists behind us become successful and achieve some of the things that we've been able to. I just find myself grateful every day. Like I never imagined the things that I'd be able to do, the people I'd be able to meet, and the mentors and the support I would have. And INACSL's been an immense part of that.
Mm-hmm. I know.
That's awesome.
Yeah, I remember going to a session at my first INACSL, and I was in awe of this person that just knew so much about SIM and operations. And I was worshiping her, and I kind of stalked her for a few years. And over the years, we became friends, and now she's on the board of directors with us. And so she really, another person that impacted and truly gave and spent hours on the phone and coaching and guiding. And Chad really introduced me, and probably Carmen had someone too, into the simulation network that is global. Because, I was so much in my little world of this skills lab that he's like, no, there's Society for Simulation in Healthcare. There's an INACSL, and people around the world are doing this, and we're saving lives. And so that really was a piece that I think, too, propelled me to have so many opportunities globally.
Yeah. I think, too, it's like you want to make a difference. Like we're in healthcare because all of us care deeply and want to make a difference and an impact. And so, in my hospital role, so when I was an educator on the hospital side, I felt I was able to impact so many more patients by providing that education and the resources and the tools for the nurses to do their job and do it safely. And like Penny said, learn how to do those skills in a safe environment, such as we had a simulation center at the hospital where I was at. And so we were very fortunate. And then now in the academic world, your ability just to make an impact is so much more significant when you're able to connect with other individuals who are doing the same work and also hearing how people are doing that work across not just the United States, but as Penny said, across the world, because there's amazing things going on. And to be a part of that is very humbling also.
That's really, I feel like you all hit so many of the nails on the head there. I think that sim saves lives. And sometimes I really like the part that you said, Carmen, that it was easier to see that mantra when you were working in the hospital, you're working closer to patients. But I think sometimes when you go into academics, it's harder to see. And I love that you made that connection where sims still save lives. And in fact, you might be even having more impact as you're connecting with others doing the work, as you're part of this global community, so that the work that you are doing is then shared across the world and impacting even more patients and even saving more lives. And I think that sometimes can be forgotten and hard to see.
I would say the other thing that I have had the opportunity on the academic side, and sometimes it's only been the last, I would say, 5 years that I've had this opportunity, and I've been in academia for just over 10 years. But the ability to take the simulation that we're doing and the work we're doing in simulation into the community. And so that's really huge too, in terms of our ability to make an impact. So we've participated in large scale disaster simulations within local
Mm.
counties. We've partnered with local counties to create a sexual assault nurse examiner program that's training nurses all across our state. And again, if you had asked me even 10 years ago, would I be doing these things? And I would not have had any idea. So, the doors, the opportunities come to you. You have to be willing to take those risks. And also, like I said, it's the people around that you surround yourself with that also encourage you and support you and maybe even, push you a little bit to do some of those things that you thought you couldn't.
100%. The people around you matter so much. I actually appreciate even hearing you say, I never thought I'd be doing this, and some of those incredible things that you've done in your community that you're sharing. I'm really glad to circle back to saying, I'm really glad that you stuck it out and that you were vulnerable enough to share that first job or first place you were in the critical care unit where it wasn't super welcoming and they weren't about the idea that we know now that people can learn. And the way to learn is not by making folks cry or telling them they can't do it, right? It's the exact opposite. And I think simulation really embodies, you think about psychological safety and a lot of the concepts that I imagine over the many, many years now that you've been doing sim, you've been able to come to that you maybe didn't have the language for at that time. And I love that when you first got into sim, the first thing was, hey, you're going to do sim for the critical care program because, you get to hopefully heal some of the trauma by giving back and by being able to, you know what, I don't want that to happen to someone else.
Yeah. And I think it's also, you don't want something like that to define you. So, if nothing else, hopefully my story is a story that you can overcome and stay true to what your dreams and your goals are, and you'll get there. My path was a little bit different than maybe I initially envisioned as a new graduate nurse. But ultimately, today, I can look back and say I'm grateful for that experience because it made me who I am today as an educator. And it's really, like you pointed out, changed my values and how I interact and engage with individuals, even on the acute care side. If somebody did make a mistake and it was with a patient or not in simulation, the way that we handle that, the way we navigate that together to explore what factors played a role in that are really, really important in that individual, their healing and their ability to overcome and become a better nurse, a better person, better healthcare provider because of it. And it really, like I said, has framed who I am today and my desire to never make somebody feel that way, no matter what they've done. Nobody goes into healthcare wanting to make a mistake. That's my mantra. We don't intend to, and then it becomes a self-fulfilling prophecy when somebody is constantly, yelling at you or belittling you, or, you're so afraid of making a mistake, you will make a mistake. And that's ultimately what happened to me. So I don't want an environment like that for any of the nurses or healthcare providers I work with.
You will make a mistake, and also you're not going to be comfortable speaking up, right? And I think that's a
That's
big
true.
part in simulation that we
Yes.
we try to get at in our practice and in our scenarios when we do simulation.
Thinking about the nurses and the facilitators and healthcare providers in general, but taking a different stance to a personal patient level. My son, had open heart surgery at birth with a cardiac defect. And then when he was 19, 25, and 26, he had cancer, had a stem cell transplant, went through chemo, was married. I mean, has had a rough road. He's doing well today. A few little issues, but doing well. And when we're going through all of that and you're on the receiving end and I'm going, how are you a nurse? For the most part, we had excellent care, but there were occasionally someone I'm like, you could use some team training.
Let
You
me do
know,
some simulation with you.
that's right. Can you come to the sim lab and let me help you out? So that really gives you a different perspective. And I remember Chad had done, and it's actually on SSH's website, Stories from the Heart, Patient Stories from the Heart. And he spoke about his sister who was in a car wreck and what they had to go through as a family and how it impacted him to truly impact healthcare for patients. And I try to really emphasize that with not just our facilitators, but our students is we're not doing this just for fun. Like this can truly change and affect patients in a positive way. And I was on a call today where my friend's, a family member is going through some testing and so forth. And they said literally they were so focused on the checklist, they forgot they were doing the checklist for a different procedure and they wouldn't get out of their mind that that was it. And they couldn't have discernment on what was going on around them. And of course, my mind's going, they need some simulation. We can help with that.
Situational awareness. We're going to help with
Situational
that.
awareness, so I don't think it ever leaves my mind about this eventually, even in academia, it eventually leads to excellent patient care, but also care for our facilitators and nurses and others, and setting them all up for success that, we can take better care of our patients and our staff as well.
Yeah, one of the things I hadn't expected in our conversation to get to this, but what I've heard is it's very personal for all of us, at least the three of us as we're speaking, even as you shared about your own journey and Chad's journey. And, I also had a similar experience when I was on the other side when my father was critically ill and the things people had said to me. And I'm like, oh boy, let's get you in a sim lab. At the time, I couldn't say that. I was very emotional. But when you're on that other side, and it sounds like for at least three of us, and I think many people in simulation, it's very personal. And I think that also makes the simulation community what it is, where we are all in it to improve patient care, to help our colleagues improve the care they're able to provide tools to folks. It's not about us and, like you said, not necessarily there just for fun, although I do think it is fun what
It
we
is
get to do in
fun.
simulation. So I think that's really important as we move into kind of talking about your roles in INACSL and specifically INACSL and the standards of best practice, which is something that has huge impact around the world. And I'd love to hear a little bit more about that and just your experience in that. I know, Penny, you're coming off of you have a few more months left in your role as president. And I know, Carmen, you're coming in as the president-elect and you'll be president very soon. I'd love to hear kind of what INACSL has been working on and connecting that to kind of these standards of best practice and such.
Well, I guess for the standards of best practice, there were some very visionary leaders in simulation in INACSL back in, I think it's 2011, if I have my years correct, that developed some standards. And throughout the past, I don't know, 15, 16 years, it is based on evidence, systematic reviews, different types of, in the literature and truly digging into the science behind it. And I think our goal with that is really doing good sim and setting guidelines, and not even guidelines, at other level of a standard. And they have evolved and developed throughout the years, and there's like 10 of them. And I chaired the standards committee a few years ago, which that group was such a phenomenal group of people. We did this during COVID, so we were almost a support group. We became so close. Now, we did disagree on things, but we did always come back together for the good of developing the standards. And I think our focus of INACSL is to continually provide these standards. They're free on our website to people doing sim internationally. Our committee had an international presence, an interprofessional presence, and I know this next round is coming up to truly even go further to ensure they are internationally focused for doing, as we say, good sim. And we feel it's important, and we continue to work on that and disseminate. And you would be surprised. There's so many people that don't know that they're available.
They are available, as Penny said, for free. A lot of times people don't realize that. So they can go to our website and you can download them for free. So really, there's not any reason that people couldn't have access to them wherever you are in the world. We are working on publishing them in potentially different languages. And in 2025, we had our cornerstones. So the 4 cornerstone standards were revised, and that's your pre-briefing, facilitation, debriefing, and professional integrity. And as Penny mentioned, we'll be starting the next round. And there was a lot of intention with the 2025 revisions to do those systematic literature reviews so that we are looking at the best evidence to inform how we do simulation and that we're doing high quality simulation ultimately so we can reach those goals that we've been talking about: high quality patient care, patient safety, safety for the nurses and the providers that are working together as teams. There's a standard on IPE. So there's a ton of great resources on our website available, whether you're a member or not. And then there could be some opportunities moving forward for people who are looking to get involved to participate in the next round of revisions. So like Penny
Mhm.
said, we're always looking for volunteers to help us within the organization. And that could be an opportunity for some people to consider. I wasn't on the actual standards committee, but I was a reviewer of the first standards committees. And that was because I was doing one of those fellowships I listed. So just by chance, all of us that were in that fellowship were given the opportunity to participate in reviewing the standards before they actually got published. So, even if you're just starting with little baby steps, it can help advance your journey in simulation.
Sounds like it was very productive to be a fellowship junkie for you. So that's really helpful. One, really important for people to know they're available, and they're very user friendly, right? They're very visual. I'm a visual person. And so having just looked at those and used those in a variety of work that I've done, it's really great to be able to access them so easily and to be able to understand them so easily, and that they're based in the evidence and literature that we know for many years that simulation's been done. So I think that's awesome. As you made those changes in 2025 and as you're going into this next round one, I love that you said that you're open to folks who would be interested in joining. So if anyone in our audience, they can reach out. And two, I know you all mentioned that you were being more intentional with affiliates in this next round. That's one of the reasons we've all come together too as IPSS, and really having more of our members get involved with INACSL and know that you're there, know these standards are there.
It's super important that we're involving our affiliates, and we're also getting perspectives of our international affiliates and partners
Mhm.
in simulation, because simulation looks different, right? Depending on where you're at, even across the United States. So it's
Yes.
important that we're getting all these perspectives. It's important that we're getting the perspectives from the academic side, but also the practice side. And so we're trying to be very intentional about having all of those voices so that we know it's not a one size fits all, right? But we want our standards to reflect best practice across all different types of settings and, I would say, environments as much as possible.
And we don't quite know what it's going to look like since we are doing a call for our NACSL volunteers for summer. And Farrah Bowler has been our liaison for standards. And so hopefully in the next 6 to 9 months, we will figure out how that's going to work for us, because we are pretty passionate about the standards and know that, as Carmen said, the international perspective is so helpful, because we have a pretty large, I won't say enormously large in INACSL, but we have a very active group of international folks that are engaged with us, and we have regional interest groups, and we also have our new international community of practice, which will be launched here in a couple of months. So really engaging people and networking people around the world. And I think that where it comes to, we're better together, and the
Mhm.
synergy, I mean, I know there's always going to be different focuses and objectives for organizations, but also how do we help and support each other? Because we're all out for the same goal, ultimately.
I think that part's important, right? Because there are all these societies, and I think we've already kind of alluded to this. We're all working together, and it's all interwoven. Even when you mentioned chat apps, like I thought of SSH, but I think just thinking about the various societies and how we, again, getting back to the culture of simulation, is very much more collaborative, I think, and that's nice. And you spoke a little bit about even thinking about endorsement versus accreditation and how different societies we differentiate ourselves in what we're doing. And so it's really great to even have you all here speaking to the IPSS members to say, hey, get involved in these other societies. There's a lot of synergy here and opportunity to make some connections, is what I'm hearing you all say.
Absolutely. And each of the organizations, we all offer different things. I think a lot of us are members of multiple organizations.
Mhm, mhm,
One that we haven't mentioned yet would be the Association of Standardized Patient Educators,
mhm. Yep,
another
I was thinking of ASPE, yep.
organization for our ops people, SimGhost. And
Mhm,
hopefully we're not forgetting anybody, but we are all in this together, as Penny said, and we all have the same goals. Each organization could maybe meet your needs in different ways and provide different opportunities You mentioned endorsement, and we do want to highlight too that it is different than accreditation. And as Penny has said, it relates to our standards, but it's really looking at organizations, whether they're academic or practice side, doing high quality simulation. That's the difference. And how are they applying those core four standards? And so it can be a great starting point that could lead an organization to accreditation. It's not a requirement for accreditation, but it definitely could help an organization, realize that the quality of what they're doing would maybe be eligible for accreditation down the road. It's a different process too than accreditation.
Mhm.
That's also important to know. And it looks a little different because you're providing evidence that you're doing high quality simulation. And that's the focus.
I like that. I think one of you in a previous conversation had said it's about doing good.
Mhm.
Because accreditation also wants you doing good sim, but it is a full comprehensive review of policies.
In your
Are
entire
you training
center.
your
Yeah.
training facilitators, debriefers, and there's
Mhm.
multiple
Mhm.
levels of accreditation through SSH, which I know ASPE also
Mhm.
has their standards and accreditation process with theirs, and there's probably others because we're ultimately wanting to have a good program as well as good sim. So I think there's synergy between accreditation and doing good sim and then INACSL endorsement program as well. And people are in different places in their programs as to
Mm. Mhm.
which, and I think they're different. While there is some connection, they are different, and I think they're both very important. And we're actually looking at, like we have standardized patients, but we have a wonderful standardized patient center that we collaborate with, and they are accredited. Looking at, is it something that since we are using, do we need to look at the ASPE accreditation or the SSH accreditation for that as well? So lots of
Yeah.
opportunities.
I like that. And thinking about where are the intersections. I like where your mind goes with that, Penny, of just where are the
Mhm.
intersections and how do we, again, pull more people in and really create more synergy in the work that we're doing, which is really incredible and ultimately hoping to save more lives.
Mhm.
So I love that. So I'm going to bring us to wrapping up. We could talk forever, I think. I think this has been really kind of very natural and just a great conversation. I've really enjoyed chatting with both of you and excited to see kind of even as you transition your roles and things to come from INACSL and affiliation with IPSS and opportunities for our members to get involved as well with you. Anything that we have not talked about or anything that I've missed that you want to make sure we're sharing or mentioning here?
It almost goes back to our original conversation and where when I started, I was new. I didn't know a lot. I didn't know what was out there. And there are a lot of people, even that I work with across Alabama and other places, they've never heard of an Axle or
Mm,
SSH or ASPE
mm,
or standards. And so they may start at a very basic level. I have a really passionate heart for those that are just starting out because it was me and a teaching assistant and go forth. What are the things that we can help give back to our future leaders? Because, Carmen and I, we're getting a little older and we may get to
what
retire
are you
one day.
talking about? You
Yeah,
look
yeah.
very young.
But, how do we continue growing a wonderful cadre of simulationists? And I see the simulation community in the last couple of years, I feel like it's a whole other place. The international perspective and being involved in an Axel and SSH, you see so many things out there. And I'm always sending something to my staff. Oh, look at this article. Look what they're doing. They're doing this in Saudi Arabia or in Qatar. So I think we just learn from each other. And if we can get outside of our own little box sometimes and really look and think about the different perspectives related to sim. Sometimes I get tunneled and the community has really been, I want to say, a home for me. I call them my sim peeps or my sim friends. I'll text someone across the country or around the world and say, hey, I got a question. What do you do for this? So yeah, I just think sharing and mentoring and growing others is kind of where I am at today in my career.
I would echo what Penny said. It's exactly where I'm at as well. And we want others to be successful and really just getting started with our organization or other organizations. A few things that we haven't really touched on in terms of what INACSL offers are our educational offerings. We have our conference
Yes.
coming up in June 10th through the 13th in Oklahoma City, where Penny's going to do some line dancing for us. She's got her purple cowboy boots. So that's an opportunity. But if you can't travel or it doesn't align with your schedule, we have webinars, we have podcasts, we have courses that you could do online at your own pace to learn more about the standards and simulation. And so, like Penny said, it's really just kind of getting started. Visit our website, see what we have to offer, and try to get involved. As she mentioned, there are calls out right now for volunteers, but if it's not the right time right now, there'll be some in the future too. So always kind of keep looking for that.
Awesome. Well, I appreciate both of you taking time to join me on this podcast and to come speak with our audience. And I love that we're ending on that note of there's so many educational opportunities for folks to get involved and to learn and to share and come full circle in their simulation journey as well with INACSL and with IPSS. So I appreciate your time, and hopefully till next time. Thank you.
Yes, thank you.
Thank you for listening to this episode of the IPSS Podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.